Hi, I'm Angela and I'm an adoptive parent with Family Futures, and I'm here with Sarah Kerrigan, who's a dramatherapist specialising in Theraplay, and we're going to be talking about Theraplay and what it's about, what it's for, the effects of it. So Sarah, just starting off with some general stuff, what's your background?
So I'm a dramatherapist, as you've already said, and I've worked at Family Futures for about 9 years now, so quite a long time. I actually started as an admin person here. I was part of the admin team, and I just felt so inspired by the work that Family Futures were doing. And so yeah, that led me into drama therapy and to working with adopted children, foster children and their families that have experienced complex trauma. So that's the main bulk of the work that Family Futures do.
And what is the training for Theraplay? What training do you undergo?
So there's sort of a series of levels to Theraplay. You have to go and do 2 trainings, so there's level 1 and level 2, and then you join what's called a practicum. So there's a number of, you have to record your sessions, so there's a number of videos of your work that you have to submit, and you have to be supervised by a Theraplay practitioner. And so you sort of work up to each level. You do 40 sessions, and then you're a foundation level practitioner, and then 40 more, and you're an intermediate level, and then 40 more, and then you're finally a Theraplay practitioner. So it's quite extensive.
Yeah, so it sounds intense. And what, in a nutshell, if you can, is the aim of Theraplay?
So the main aim really is to strengthen the attachment relationship between parent and child. That's the key really, that's the big part of the approach. It's really about respectful and playful engagement with a child and a parent through structured games and activities. And the idea of Theraplay is that there's 4 domains of relating. So there's structure, engagement, nurture and challenge. And you want to be able to help a child manage in all of those areas and enjoy all of those areas of relating. And it's about helping the child feel calmer and just having a bit of fun as well.
We're very fortunate to have had some Theraplay, or quite a lot of Theraplay sessions here at Family Futures, and they're within quite a long therapeutic session. But how, in general, if somebody was just going to have Theraplay on its own, how long would a session be?
Yeah, so if you're just thinking about Theraplay, it really depends on what the child can tolerate. So it could be, you might start out doing 20 minutes and then you might extend over time as they become more familiar and feel a bit safer. It could be anywhere roughly between 30 minutes, 20-30 minutes to an hour maybe.
Okay.
Yeah.
That's good. And how long would you typically work with the same family?
I think we do things slightly differently at Family Futures. I mean, our ideal, because we work with children who've experienced complex trauma and have a lot of complex difficulties, they really need a lot of time to develop a trusting relationship, to be able to feel safe and to be able to have their attachment needs met by their parents. So actually our ideal is a year. Okay. We do shorter bits of work, but it really depends on what we've seen in the assessment as to what the child needs.
Yeah.
But in terms of Theraplay, I think it varies between something like, it could be 8 sessions, 12 sessions. I do know some Theraplay practitioners that do work with children for a year. So I think it just depends on the need and what sort of funding's available, I suppose.
Yeah. Well, that leads very nicely on to how would you assess a child? What do you do to know what to do?
In terms of Family Futures do quite a thorough assessment, so it's slightly different to Theraplay. The Theraplay merely informs part of that. It's a multidisciplinary assessment and it's quite holistic, so it looks at it's based on the understanding that a child is affected physically, emotionally and cognitively by trauma. And so we see a family for a whole day here, we do a Theraplay MIM, we use psychometric questionnaires and other assessment tools that really give us a sense of this child's internal world, how they relate, and their expectations of adults around them. So that's quite a thorough assessment. If you're thinking about Theraplay on its own, then the Theraplay, it's called a Theraplay MIM, which stands for Marshak Interaction Method. It was created by a lady called Marshak, so hence the name. And it's based around a number of games and activities. They're quite structured, so a child and a parent would sit together at a table. There'd be a camera somewhere, which is a really important part of Theraplay, so that the therapist can look back at the assessment and then formulate a treatment programme. And really the therapist is looking at how does this child and parent manage with structure, engagement, nurture and challenge. You know, does the parent set appropriate limits and expectations, and is the child able to accept that? You know, is the parent attuned to a child's affective states, and is the child regulated by that? In terms of nurture, it's, you know, is the parent offering appropriate, are they offering affection and positive praise, and is the child able to accept that? And also, is the child able to self-soothe in times of stress? And in challenge, it is, you know, do they have opportunities for mastery and growth? Are the parents setting appropriate levels of challenge? And is the child able to keep trying even though a task might be really hard and really experience success? So you're really looking at all of those domains. It's a really helpful assessment tool in thinking about what's needed going forward.
I know that some parents find the idea of a MIM quite scary, that it seems some of the games seem very silly. We've done some MIMs, and I know that lots have been revealed through that. But could you just say a little bit about those games?
Yeah. So they are games, and they do feel silly, and they feel quite simple as well, but actually they're effective because they're based on the therapeutic benefits of play and sensitive caregiving. If you think about babies and how they learn about the world and relationships and themselves, they learn through play and attuned caregiving. So if they haven't had that, or they haven't had a positive experience of that, then it's so important to do this work with them and to help them experience that positively.
That's great, thank you. So could you describe a typical Theraplay session? There's probably changes from child to child, but maybe you could show us a few things that you might use.
Yeah, let's do some games so you can get a flavour of Theraplay. Okay, so you're going to be the child, Angela, and we'll pretend there's a parent. The parent would normally be next to the child, or the child might be sat on the parent's lap, and then I would be here, so quite close, quite intensive. Okay, so it's great to see you again, Angela. It's so nice to have you back. So we're going to do a special hello like we always do. So how would you like to be said hello to today? Would you like a shout, a whisper, or a wave?
I think I'll have a whisper.
Oh, okay, Mummy, are you ready? On three, we're going to do a whisper. 1, 2, 3. Hello, Angela. We've said hello to you. What about? Why don't you ask me what I want?
What would you like to be? How would you like to say hello to us?
Oh, Angela and Mummy, can I have a wave, please? On three, you're going to do it together. I'll count you in. 1, 2, 3.
Hello, Sarah.
Hello. Right, we've said hello. Now I've really got to check what kind of girl we've got with us today. We've got a giggly, smiley girl. So how have you got? There's one hand, and there's 2 hands. Oh, great. And how many fingers have we got today? 1, 2, 3, 4, 5. We've got 5 and 2 fingers. Amazing. Let's check. We need to make sure we've got all of them. 1, 2, 3, 4, 5. Hooray! We've got 10 fingers. Phew! Can't play our games without little fingers, can we? And do you know what? I noticed you had a little mark on your hand. I've got some special magic cream here. Let's see. We could just do a little check. I'm just going to put some there. Does that feel to do it nice and firm.
Nice and firm.
Yeah.
Not tickly.
Hey, you've got lots of freckles, Angela. That's lovely.
It's much less embarrassing than the child's. It's the child doing it.
Wow, look, Mummy, look at this lovely hand. It's lovely and soft. Okay, I think you're all here. Great, let's play another game. Okay, what is your favourite fruit?
Bananas.
Oh, bananas, great. Okay, I'm going to balance this on my head, and then I want your hands like this. And when oh no, other way around. It's got to be on your head,
Right.
silly Sarah. There we go. Okay, when I say bananas, I want you to drop that beanbag into these hands. Okay, so bath, bacon, beans, bananas! You did it! Well done! Should we try that again? Let's think. What's your favourite animal?
Tiger.
Oh, good one. So you ready? Ready for the balance? There we go. Okay, great. Okay, when I say tiger. So, tights. Tissue. Tiger!
Ooh!
Oh, this is easy. You're so good at that.
So let's just pause there and maybe you could explain what those different elements are all for and how they help the attachment with the parents.
Exactly. Well, really it's about, you want to make the child feel special and you want them to feel seen, heard, valued. It is quite intensive.
Yeah, to really.
And there were moments even for you there, Angela, where it was a bit like, so you really have to, particularly when you work with trauma, you have to really think about what you're doing in the room and have a knowledge of the child's trauma history. You know, I might not use lotion with a child. You might need to reduce the intensity of what you do. So those are all questions to have. Yeah. But in terms of those activities, Theraplay always follows a very similar sequence. It's quite structured. So there's always some sort of way of entering into the space or the room where you're going to do the Theraplay games. Then there's always a hello, so just sort of acknowledging that everyone's here, including Mummy or Daddy even. Then there's always a Hertz, what we call a Hertz check in Theraplay, or some sort of checking of a child. And it's really just about noticing the child and the child feeling that they are cared for, looked after. I mean, often that's a really tricky one with traumatised children. And you might do it with bandages, you might just check that their body parts are there and not really refer to Hertz. So you might need to think about that. And with the beanbag drop, so we're learning about the child. We want to know about their favourite things. And we're also helping them to follow instructions and experience success. It's very simple, but you know, when you drop the beanbag and the therapist goes hooray, the child delights in that. And I mean, that's for quite young children. I suppose the demo that we just did, you might do different things with older children or other children depending on the way that they present. So
that's great.
So just a flavour.
It was quite interesting to be on the receiving end of that, not just my child. So I've spoken to some other adoptive parents and there were a few questions coming from them. Would you say it's important to do Theraplay games specifically at home? Is there a way of sort of incorporating them into the day, do you think?
I wouldn't necessarily do a session like you would say if somebody came here, you know, we're going to do a Theraplay session now. I'd really advise against that. And I think it's important to do it at home, but to establish a structure here that works, so you really know the things that your child likes and that they're going to respond in a joyful way about those things. So if you can incorporate them into what you do already as part of your routine, you might do a blanket swim before bed or a little Hertz check with lotion or plasters or whatever it might be. So, or you know, you might do a pizza massage, create a pizza on their back or something, but just pick up on the things that the child loves and just integrate it into what you do. I wouldn't necessarily just do a session at home.
One of the parents said that whilst her child had been very cooperative in the sessions, he just wouldn't engage at all at home. So what would you say about that?
I think if the child is not cooperating at home, then they're really telling you that they're just not ready for that. Right. They're just not up for that. Or that maybe there's something different about doing it outside of the therapy session that's just, they're in their home environment with you, and there's probably must be a different feel for them about it. But I think it should be joyful and not needing to be forced. So I'd really just don't be hard on yourself about, that you need to be doing these things. It's just find spontaneous moments where you can do it, where you feel you've already in a place where you're connecting with the child.
Yeah. Okay, that's really helpful. And very fundamentally, I guess, how do these games help the trauma that the child's experienced? How do they do it?
Yeah. Well, if you think about the impact of trauma, specifically, the kids we work with here, it's developmental trauma, relational trauma, and so that has a huge impact on the child in terms of how they view parents and caregivers. They often perceive adults as being scary, or have even experienced adults as scary, unreliable, unsafe. So the idea of relating in itself is scary, and that then means that there's a lack of reciprocal enjoyment, a lack of eye contact, a lack of appropriate boundaries, and lack of empathy sometimes. So if that's the impact, then Theraplay is ideal, because actually you're really working on those things. You're creating a safe environment that's really structured. It's the same structure pretty much every week. The child gets used to it, and they're experiencing adults as being containing and setting boundaries, but in a safe and playful way, and also experiencing moments of connection that feel joyful rather than scary. At the same time, you have to be really mindful that this child is going to be maybe slightly uncomfortable for the child, overwhelming, maybe even scary. And so this is where I talked earlier about needing to modify for trauma. You need to be so attuned to a child's responses in the moment, to their mood, to their reactions, and you might just have to reduce the intensity of what you're doing, make less eye contact, give more choices, no surprises, all of those questions.
Which does lead on actually to the next one is, whilst you're taking, a lot of our children are very controlling, so how do you balance the sort of structure with, and wanting to modify it, but then not really giving the child the control of the whole session, because I know lots of our children would really want to take control in such an intense environment.
Yeah, and that's a real, can be a real challenge and a real balance to strike as well. I think, we have to respect the fact that they're controlling for a reason, and that it's a form of self-protection and safety, so you have to honour that really. If you challenge it, you want a child to engage despite mild discomfort, and if you take all of the control, they're not going to engage. So you have to give choices maybe, and factor in as the adult, they might need to take the lead in some things and feel that they have some agency. So they might help you get the Play-Doh out of the pot, or blow some bubbles and be in charge of the wand for a little while. But ultimately, you as the therapist and the parent also are still in charge of the structure, because you've sort of set it that way. And a child sometimes says, I've got an idea. And I say, great, let's do it next time. So, the child feels heard and validated, but you're still in control of the session. But it is a real balance to strike. And I think sometimes we do have to change what we're doing. If I'm doing an activity 5-6 times and the child starts to feel unsafe and then gets controlling, then I need to think about what that's about. And that actually maybe that's too much to expect a child to do, and we need to change things. And I'll be quite transparent with the child about that.
Well, we've certainly been on a journey with our child doing Theraplay sessions and changed things as we went along. And then I mean, you touched on it a little bit, but could you say something specifically about how Theraplay supports parents in their parenting?
Yes. So parent work is a big part of Theraplay. You know, me as a therapist and you as a parent, you know, you have to be able to collaborate in the room and have a good relationship. So initially there is some parent work that happens before you engage in sessions with the child and parent. We record all the sessions with a camera, including the MIM, which is really helpful. So we would initially look back with the parent at the MIM assessment and really highlight the positives. Often parents are coming feeling that they've failed or that they're no good because they can't get their child to listen or do things. And often, you know, in traumatised families, play is the first thing to go. So actually the play aspect of this approach is just as important for the parent. But also sitting there with the parent and helping them, watching the recording, helping them see the positives, but empathising with the difficulties. And then also being able to reflect with them, what do you think might be going on for your child at this moment? Why are they behaving in this way? And so it's about supporting a parent to see what's underneath the behaviour and have empathy for their child. And also at the same time, it's a great opportunity to say to the parent, you know, do you remember how you felt in that moment? And how
self-reflection.
How would that affect your child? And so it's really helpful in that way.
And in Theraplay, is the parent always shown them in after as part of the assessment?
It's really important. It's a really important first step, and because otherwise, you know, we think we are one way in the moment, but actually when you watch something back, it's quite powerful because you see things you maybe didn't realise about yourself in the moment, you know, good things.
I think that's great, really great, really comprehensive. So Family Futures is one organisation, and in the country there are a few places that do Theraplay, but if people are looking for Theraplay practitioners, you know, good places to go to find help, what are some questions that people can ask, and how would they go about finding somebody who is really going to help them?
So I know that on the Theraplay website there's a Find a Practitioner where all the fully qualified Theraplay practitioners are listed that are sort of doing this practice around the country, so that's a good place to look. I would want to know, if it was me, what's their level of qualification and can they evidence that? You know, where are they at? Are they still doing the training, or are they fully certified? And then you'd want to know that they're supervised and that they're on the Theraplay practicum. It's very important. So you know they're fully, you know, they have the experience and they're going to be legitimate.
I think that's really helpful to know, thank you.
And what else? Also, it might be good, you know, you have some early sessions. It's really important to have some parent sessions so that you can get a feel for, does this person like me? That's really important. Do we get on okay? Because it's really important when you're in a room with a child, and it just works best if you and the parent have a really good relationship. And you might just want to see how the early sessions go and then review. You can always review. So that would be my advice.
Great, thank you. Well, thank you, Sarah. I think that was really helpful, and I hope that answers some questions about Theraplay.